So the different types of liver tests that can tell you whether you have liver disease or not are basically two types. One is the blood test and the other one is radiological tests, etc. So if you talk about blood tests, one of the most important tests that people do to diagnose liver disease is the liver function test or the LFT. Now if you look at a LFT report, it has got various components. There will be serum bilirubin, then there will be AST, ALT, then there will be serum albumin, serum globulin. So these are the 5 or 6 alkaline phosphatase, 5 or 6 common constituents of a liver function test. Now each of these components of the liver function test has a relevance. These tests are going to tell you that how are the different aspects of the liver working. Now the liver function test or the LFT is basically a blood test that tells you about the functions of the liver and status of the damage to the liver. Now the various components of a liver function test are the serum bilirubin level, AST, ALT, alkaline phosphatase, serum albumin and the serum globulin. Now the serum albumin tells you about the synthetic functions of the liver, because you know albumin is a very important protein inside the body and it is manufactured only inside the liver. So how much your liver is synthesizing albumin is what the albumin test tells you. Now the AST and the ALT are two enzymes which are present inside high concentration inside the liver. Once the level of these enzymes increase up to a certain level inside the body, that means the liver cells are getting damaged because of whatever reasons. So the AST and ALT levels are basically markers of the damage which is happening to the liver. What does the serum bilirubin tells you? Now the serum bilirubin is basically a byproduct of the red blood cells being destroyed in the body, and the liver is responsible for clearing those bile pigments from inside the body. Once this bilirubin starts increasing in your body, that means the liver has gotten damaged to a point where it is not able to perform its excretory function of removing the bilirubin from the body. There can be rare instances where bilirubin can be increased in the body because of excess breakdown of blood cells. However, most of the times a high bilirubin level means that the liver is not working properly and it is not able to excrete the byproducts from inside the body. The other common tests which are done to diagnose liver disease are the radiological tests. The common radiological tests are ultrasound, CT scan and MRI of the liver that are performed. Now what these tests tell you, these tests basically tell you two things. One, they tell you about the quality of the liver. Quality of the liver as in, is there excess amount of fat inside the liver or there is excess amount of fibrous tissue inside the liver. Now we all have seen ultrasound reports showing grade 1, grade 2, grade 3 fatty liver disease. So that basically means that the ultrasound is a good test to find out crudely that how much amount of fat is present inside your body. Also, if the liver cells start getting replaced by fibrous tissue, so ultrasound or a elastogram or a fibroscan is another test which can be done to diagnose the amount of scar tissue or fat which is present inside the liver. The other thing what ultrasound or CT scans can also tell you is the presence of tumors or tumor-like lesions inside the liver. Ultrasound is not a very sensitive and a specific test for telling which kind of tumor it is. So if the ultrasound picks up a small spot or a suspicion of a tumor or a tumor-like lesion inside the liver, a CT scan or an MRI then has to be done to confirm that what exactly is that thing which the ultrasound is showing to be present inside the liver.